Hi, I'm Dr. Kay McQuire, and I am Vice President of Health for the Westie Foundation of America, which is a 501(c)(3) that has been designed for bettering the health in our Westies through research and education. Today, we have Dr. John Robertson, who we are partnering with a new cancer program, and I'd like John, would you like to introduce yourself and give us, some of your background?
Yeah, Kay, thanks very much for this opportunity. Really, it's a great joy to me to be associated with the Westie Foundation of America. And if you all have gone back to the dim recesses when you looked at the Westie Health ebook, I was one of the first authors of that. And you can see a lot of pictures of me as a kid and my mom and her dog, who was a Westie, who I didn't really get along with very well, but it really did make me fascinated with the breed. And I think I've had a lot of things going on since then. And every time I do one of these talks, I kind of think that mom is looking down and thinking that kid's doing okay.
Yeah. Well,
um,
I mean, you have quite a professional background as well. Go for that.
yeah, Kate, I am a veterinarian, as you know, veterinarian just like you, also a biomedical engineer. And you may think that that's kind of an odd mix of things to be happening, but from the time I was a little kid, I just like to tinker and build things. And so much of my professional life has not only been spent doing pathology and diagnostics and working in veterinary practice, but I also design medical tests and medical devices. And I'm very happy that we've gotten to the point now where we've developed a technology that I think is going to be important for dogs in helping to detect cancer and determine whether cancer therapy is working, and perhaps even with the help of the Westie Foundation of America, be able to start working our way back to an early detection test. Now, the test that we have developed is one that's based on collecting a urine specimen. And so I've got, everybody's seen these if they've gone to the physician's office. And our test is based on getting a small sample of urine, 15 or 20 mLs, a couple tablespoons worth of urine, and we put it in a special device called a Raman spectrometer. And that Raman spectrometer analyzes hundreds of different molecules that are in there. These are not specific molecules for cancer, but they're byproducts of metabolism and inflammation. And we do a thing, we create a molecular fingerprint that is the result of the analysis. And those fingerprints are pretty specific. And we've now looked at hundreds of dogs and hundreds of dog urines and thousands of people that are at risk for getting bladder cancer or diabetes, to develop this technology. And the results are pretty exciting. So as you know, what we've been proposing is to do a large study sponsored by WFA to collect the urine of 500 dogs. And everybody who's looking at the video that's got a Westie is kind of broke out into a little smile about, okay, John, not real easy to get that done. Okay. But John has done this. John will arm you with pie pans. We'll arm you with ladles. Okay. We'll follow the little dogs around. Okay. And we'll get our specimens. Now, the plan is that our first get together on this is going to be at the show in Montgomery, coming up the 4th and 5th of October. My team will be there to assist owners with the collection of specimens. And then once the specimens are going to be collected, we're going to freeze them down and ship them down to my lab in Blacksburg, Virginia. And at that lab, we're going to do this Raman analysis. And if you want to kind of look at the down and dirty on this, I'm going to share a screen and show you just one or two slides that show you how we do it. And then certainly we'll turn it back over to our hosts here. So we know that a goal of everything, let me know if you can, there, how's that for sharing?
It's good. We can see it fine.
Excellent. So we've developed a rapid, inexpensive, and non-invasive cancer screening test for dogs. It's based in urine. When I say rapid, we analyze a specimen in about 15 seconds. We process the molecular composition with some mathematics that I really have no idea how that works. I mean, I have trouble with my checkbook, but I employ smart people that can figure it out. Okay. And we take that urine specimen and find these molecules. And so the thing that we do with this test, let me bring this one up, okay, is it detects changes in metabolism. And we use a little Raman spectrum here, spectrograph here. It's a very robust piece of equipment. We put the urine specimen that we've collected into a vial, okay, and then it creates that kind of distinctive molecular fingerprint. And so here's one of the things that we've sort of developed computationally. Urine goes into the spectrophotometer. We then compare healthy urine, okay, with previously collected unhealthy urine, dogs and people that have got cancer, and then take that individual specimen and see how does it fit in there. And we find that we're able to really pick these things up, pretty well with a high degree of accuracy, sensitivity, and specificity. So the big question that people always have is, does my dog have cancer? And that's the thing that we're pursuing right now. So some preliminary results to share with you. And Kay and Randy warned me not to get too sciencey or go too long or we'll lose the audience. But everything looks like a bunch of dots. But let me point out to you that here we've got urine specimens from animals that have got cancer and animals that are healthy, okay, or got urinary tract disease. And our test really can separate them out very, very quickly and easily and inexpensively. Now, I've kind of gotten back on this idea of expense because I know that there are genomic tests that are out there that are kind of pricey, in the realm of $500,000, $800,000. You need a blood specimen. You go to the veterinarian, no offense, okay, to get it done. Now, our test is generally being run in the realm of around $200 or so, the amount for a standard urinalysis. And we get the results very quickly. Within a day or so, we've got the results that profiles it. So we're proposing to do a study with folks, with the Westie folks, and be able to then profile the breed. Now, one thing we learned over the last 10 years or so working with the Westie Foundation is that dog breeds are different. Even healthy dogs of different breeds are different in their metabolism. And so Westies have a very distinct profile from golden retrievers and German shepherds and everything else. And that stands to reason because they look different and their metabolism is different. We've also gotten to the point where, bless her heart, Kay and the other folks in the foundation has sent us specimens from the Pacific Northwest, from the Houston area, from up in Pennsylvania. And there's even geographical differences in the urine composition in healthy dogs that we pick up with this test. So it's kind of a neat test, and we're using it to evolve our ability to detect disease. And let me see if there's anything else. Okay, yeah, there's one more. We call the test Raman molecular urinalysis, RMU, and we think that what we're doing right now is going to put us on the path to early detection. We don't do it now, but the goal of cancer detection is to pick it up before it's a serious disease, when you can intervene and have something good happen rather than picking up when it's sort of late in the course of disease where it's basically difficult to control or incurable. We're working with purebred dogs because they've already been selected to be similar to one another metabolically. And we know that these breeds have different incidences of cancer and other diseases. So we know that Westies, of course, near and dear to our hearts, have a propensity for getting bladder cancer. And if you take a look at the Bernese Mountain Dogs, they get soft tissue tumors, soft tissue sarcomas, and lymphoma. The German Shepherds get hemangiosarcoma. The Rottweilers get bone cancer, osteosarcoma. The Shelties, Shetland sheepdogs, they're prone to getting bladder cancer also. And the Boxers, they just get about everything and all. What we're doing is looking at a way to develop a test based on urine, collect healthy specimens from healthy dogs, develop a baseline profile, and then compare them with dogs that have got disease. And again, our keynote launching event is going to be Montgomery, and we're very happy to have the sponsorship of the club to do that. I think I've given you the basics of what we're intending to do without being too sciencey and engineering type of stuff. One of the things that I sort of am fascinated about is the fact that if you get a lot of urine specimens at once, you may ask, well, how do you analyze whole bunches? Well, we actually have designed and built automated machinery to do that. And so we can process up to 50 specimens at a time in our lab, and it's unattended, takes about 2 hours to run them, pops out the results, and then we get this comparison. So we have a very high throughput, inexpensive test that's got a fairly high degree of accuracy and specificity, and we're going to provide you with some papers to read. They are very sciencey stuff, okay, which tells how the test works and the level of detection that we've got. So we're excited about this. We need to have a lot of specimens from dogs that are healthy and dogs that have got disease so that we're able to then intervene and do something about those diseases. We think this is going to be a major step forward in assessing health and in helping animals, maybe sampling them once or twice a year to be able to see what's developing and how we can intervene. So my wife tells me I always talk too much, okay, and I'll stop talking now and be certainly glad to answer some questions.
Well, the one thing I wanted to comment, I mean, you talk about Westies and bladder cancer, but I'm telling you that the incidence of hemangiosarcoma and lymphoma is ever increasing as well. I see quite a bit of it in Westies. So that's another positive for this test for sure. Go ahead.
Yeah, Kay, I'm sorry. I'm gonna break ranks here, and I'm gonna start sharing again. We've already profiled hemangiosarcoma. Not a lot of cases, but when we get a sample from your dogs that are both healthy and not healthy, we're going to profile against a lot of different kinds of cancer. So we've done a lot of work with lymphoma. We've also profiled hemangiosarcoma, and the one I've been working on for the last 8 weeks has been osteosarcoma. So they all have different fingerprints, same urine specimen. We run them against the different models to be able to say what's going on. Owner comes in going, what's going on with my dog? We'll start to run it against the disease models. Kidney disease is going to be one model. We've already talked about pulmonary disease and inflammatory bowel disease. These will all be things that are going to be profiled. Same specimen, run one time through the spectrometer, but different computational models that we can use to pick these things up.
One thing, John, you also mentioned to me is that this isn't necessarily 250 different dogs in the beginning. It can be multiple samples from the same animal at different times of day or daily or whatever. You want to elaborate on that a little bit?
Yeah, Kay, that's certainly a great point to make, that when we profile an individual, you would think that probably their urine composition changes a lot day to day to day, okay, weeks to months. I've been profiled using this technique now for 6 years, and other than the fact that I'm getting a little more bald and a little more gray, my urine specimens are staying exactly the same, except for a decrement that we can see due to age, but they're still all normal and they all line up. So we would like to see owners that have got multiple dogs that could sample them on a repetitive basis. We'd like them to participate. We'd like to have them sampling them, once a month, once a quarter, every so often. We've even done this, okay, I guess this is going on the Zoom, with consented human individuals, students at Virginia Tech. We have profiled some students every day for 90 days and found out that their urine remains exactly the same over 90 days. So we know that there's a real benefit to serial profiling the same people and animals repetitively. It allows us to see what sort of drift that we've got. And it also helps us develop this baseline signature for those animals, so that, let's say we've got a group of dogs in one breeder that has been sampled, 10 dogs been sampled or 5 dogs been sampled every 3 months. And then we start to see some changes in the urine composition of one dog that we've already got a baseline on, that's going to tell us that we need to start looking more at what's going on, that we're getting the early changes associated with disease. So again, emphasizing multiple samples, same dog, repetitive sampling, periodic samples of dogs, all is something absolutely golden for us.
Okay. And another thing I would like to point out, that the foundation feels so confident in this work that we are prepared to spend money per sample. I mean, it's at no cost to the owner at this point, and including shipping, supplies, everything. The only drawback being that we are really hopeful we can enlist people with multiple animals so that our costs can remain lower.
Yeah, I think cost containment in doing this in a cost-effective manner is a goal that we all share. So, I'm really focused on the science and the engineering and getting the answer. Okay, but I'm not naive with the fact that we need to make this readily available to people. The Westie Foundation is being wonderful in sponsoring the first part of this study. Some of the money is going to go to my lab to be able to cover having people analyze the samples, strictly cost recovery. Believe me, I'm not retired yet, and this is not going to allow me to do so. So we're going to push forward on this to make this readily available as a test. And I've also made the commitment, because of this partnership with the Westie Foundation of America, that I really prize, that we're going to keep this available to members of the association in the long term and really manage the costs on that, so that even if this eventually goes to a commercial lab like Antec or IDEX, there's going to be a very special relationship that'll persist with the Westies.
Very good. Well, we're excited. And I know that next week is going to be very positive. The event's going to be held at Montgomery County, Pennsylvania, for those of you that may not know. And it is in conjunction with the West Highland White Terrier Club of America's national specialty. So we will have a group of Westies. We'll have a lot of animals doing performance events, confirmation, everything, and a bunch of good people around to just enjoy the dogs. So, John, we really thank you very much for the opportunity. And, if there's anything else that we need to do, please let us know.
This is a great opportunity, and I want to extend my heartfelt thanks for this opportunity, and also tell you that I think I was put on the planet to be able to help animals and people and to conquer cancer. It stalked my family, it stalked my pets. Okay, I'm going to do something about it while I can. I think this is a way forward. So thanks for this opportunity.
Well, thank you. And thanks for your time. We look forward to it.
A pleasure. Anytime.